Hello friends, this is Dr. Imran, consultant neurosurgeon and spine surgeon, Srikara Hospitals. In this video, I'll be talking about brain tumors. I'll be talking about what are the different types of brain tumors, what are the symptoms of brain tumors, how do we diagnose them, and what are the treatment options for brain tumors. Brain tumor is a mass of tissue that grows uncontrollably within the brain tissue and destroys the brain tissue. More than 150 different types of brain tumors have been identified, but the most common types or classification of tumors is a primary tumor and a secondary tumor. Primary tumors are those tumors which arise from the tissues of the brain or its surrounding itself. The secondary brain tumors arise from another organ like a lung or a breast and then migrate towards the brain and grow within the brain tissue. Primary tumors can also be classified again into a benign tumor or a malignant tumor. Benign tumors are slow growing, they can be easily separated from the normal brain tissue, and that's why the outcomes of the benign tumors are usually good. Malignant tumors are cancerous tumors that cannot be easily separated from the brain tissue, and that's why the outcomes of the malignant tumors are usually bad. Secondary tumors or metastatic tumors are always cancerous because they arise from a different tissue and then migrate towards the brain tissue. These always carry a very bad prognosis. Brain tumors can present with a variety of symptoms, but the most common symptoms are headache. Headaches can be worse in the morning and can awaken the patient from the sleep in the night. Vomitings, seizures, weakness on one side of the body, numbness or loss of sensation on one side of the body, loss of vision, loss of hearing are also the symptoms of the brain tumors. However, these can also occur in normal patients. Not all patients with these kind of symptoms are carrying a brain tumor inside the skull. But whenever we have symptoms like these, it's always better to approach a neurosurgeon or a neurologist for further consultation and management. If a patient presents with these kind of symptoms, we evaluate them using imaging methods like CT scan or an MRI scan. CT scan gives us the location of the tumor, the size of the tumor, and whether it can be accessible for surgery or not. MRI gives further details about the surgery, that gives a better delineation of the tumor, the location of the tumor, the size of the tumor, extension of the tumor, whether the tumor is well delineated from the normal brain tissues or not, and advanced techniques like MR spectroscopy can also help us to delineate the chemical nature of the tumor. And once we have diagnosed the tumor, the treatment options include surgery, chemotherapy and radiotherapy. Surgery or surgical excision of the tumor is always the best modality of treatment and the first modality of treatment because it ensures that the tumor can be removed or near completely removed in one sitting, and it carries a better prognosis. Follow-up can be done with the help of chemotherapy and radiotherapy. In short, brain tumors can be primary or secondary. Primary tumors can be benign or malignant. They can present with a variety of symptoms like headache, vomiting, seizures, loss of consciousness, weakness or numbness on one side of the body, loss of hearing and loss of vision. They can be diagnosed with the help of CT or an MRI. They can be treated with surgery, chemotherapy and radiotherapy. Surgical excision is always the best modality and the first modality to treat a brain tumor. For further information, you can contact us.